I'm Dr. Donna Arnett, immediate past president of the American Heart Association, reporting on a session from Melbourne at the World Congress of Cardiology from the American Heart Association on prevention, the evidence behind the guidelines. So my particular role as an invited panelist in this session is to discuss our programs around Life Simple 7 and how we're integrating that into programmatic risk factor reduction in populations. So Life Simple 7, again, is a tool that's built on known factors that promote health and prevent disease. And so there are 4 health behaviors around obesity, physical activity, diet, and smoking, and 3 health metrics around glucose, cholesterol, and blood pressure that comprise Life Simple 7. And we at the American Heart Association developed the tools that were used to define ideal cardiovascular health, and we've developed a really impactful goal of improving the cardiovascular health of all Americans by 20% by the year 2020. So to get us there, we've had to really embrace this population concept of how we prevent disease. And to do that, we have to have very bold programs. So in my talk today, I'm focusing first on just the review of all of the data showing how impactful maintaining ideal cardiovascular health is in terms of your long-term incidence of cardiovascular disease. There have been multiple studies that have shown the Life Simple 7 health measures and the metrics that go behind them are very impactful in terms of long-term cardiovascular disease risk. So for instance, if you maintain all 4 health behaviors in the ideal range and you have normal blood pressure, normal blood cholesterol, and normal glucose, your risk of having a stroke, as evidenced in the REGARD study, a very large 30,000 person cohort study that's evaluated the long-term risk of stroke in relation to these 7 health behaviors and metrics, is virtually 0. In other words, your risk of stroke dramatically is reduced when you adhere to these Life Simple 7 measures. And the atherosclerosis risk and community study, we've shown not only for cardiovascular disease, but for cancer, that adhering to the ideal health behaviors and the health metrics almost exempts you from developing cancer and cardiovascular disease. So we're really excited, the American Heart Association, about the potential programmatically of moving our entire population into greater cardiovascular health. So some of the programs that have been implemented that I focused on today are our Check It, Change It program, where we're going out in communities around the US and enrolling African Americans into hypertension programs to reduce their risk of hypertension and to become more aware of their hypertension levels and get into treatment sooner and get adherent to treatment throughout their lifespan. Other programs we've done very successfully in partnership with the Robert Wood Johnson's Foundation, as well as the Clinton Alliance for a Healthier Generation, our partnership with the Clinton Foundation. We've really shown that we can, through policy, really change the sugar-sweetened beverage consumption of our kids in school, and that has an impact on obesity levels within children. We've shown through our teaching garden programs that we can activate children in terms of engagement in understanding the importance of vegetables by actually seeing them, growing them, and harvesting them within their own schools. So in summary, Life Simple 7 was a simple tool that was created back in 2010 with the goal of moving us in the American Heart Association and moving our population to improved cardiovascular health. And I'm delighted to say that some of these programs are already showing some effect. So that sums up the prevention session from the American Heart Association. Thank you.